Hello, everybody. I am Julie Matheny. I'm a speech pathologist and an IBCLC board certified lactation consultant. And today, backed by popular demand, is Nat, the baby OT. So I am going to invite Nat. Gotta love technology. Because we already discussed our time, so I know she'll be here. Let's see there. Yes, technology works in our favor today. Yes, it worked right away today.
That was amazing.
Hello, how are you?
Hi. Good, but I feel like I'm zoomed way in. Hold on. I'm going to figure
Yeah,
this
I'm
out.
seeing like your
I know.
goes up. There we go.
It's cool.
There we go.
There we go. You can see most of me.
Perfect.
Yeah. Cool.
Well, and
Good
I don't have my
morning.
AirPods in today. I'm going free range without my
Woohoo.
AirPods. Woohoo! Hi, how are you today?
I am well. And you?
Doing good. Happy Monday.
Totally. Yeah, it's Monday.
It actually is a really good Monday. Our weather finally got better. It's nice and sunny here, so I'm optimistic for the day.
We had a beautiful sunny spring weekend, and today's actually chilly. It's sunny, though, so I went and stood in the sun for a minute, and now I'm good. So, yeah.
Amazing. Well, today we agreed we are going to talk about one of my favorite topics ever. I love this topic, reflexes.
Mine too, so that's why we're here.
So introduce yourself really quick because I want everybody who doesn't know you to know you.
Okay, awesome. So hi guys, I'm Nat. Natalie Udwin is my full name. I am a baby OT. I also work with big kids, but primarily with infants. I'm based out of Atlanta, Georgia. I work virtually though, so I can work with you anywhere you are, worldwide as well. And I talk about babies and reflexes and infant development. Well, that's the same thing, but lots of movement. So my approach is airway based, holistic, full body, whole body feeding approach. So I work with a lot of babies that don't eat well, but also babies that just don't do baby things well. That's what's cool about OT that most people don't understand, is that we kind of can fill in the blanks and can, we get to address kind of those little quirks that nobody really knows what to do with. So colicky babies, babies that are dysregulated, babies that don't feed well, don't move well, all those things. So yeah, reflexes are my jam though. I love to talk about them, which is why I'm here.
So just for those of you who don't know, reflexes are basically blueprints ingrained in our brains as when we're born. They are the blueprints for movement. And with babies, we can trigger reflexes. So the most common reflexes that you've heard of is the rooting reflex, where if you touch the cheek, the baby turns. The sucking reflex, you put something in the mouth, baby sucks. The swallow reflex. Those are kind of the big ones that we're like, oh yeah, there's the rooting reflex. Get that baby to trigger. But there's lots of other reflexes that do all kinds of different things. And basically they trigger a response. So every time you do one action, you can trigger the reflex. And when it's triggered over and over and over and over, it creates motor patterns that as babies age, stage, and develop, they can then do those movements spontaneously without needing the reflex.
Right.
Is there anything else that you would add to that in that definition?
Yeah. I mean, so reflexes are housed in our brainstem, so they're not conscious. And I know the word reflex, I guess, should explain that, but it doesn't always. Like, they don't choose to do these movements. And they're responses to sensory input. So it's not always something being done to them physically. It can be a sound, it can be a smell, it can be it can be vision. Anything that comes in through a sensory channel can trigger a specific reflex. And so at the beginning, this is how babies survive. These literally are the only way babies survive is reflexively. And as they get older, they start to make choices, like you said, Julie. So yeah.
Yeah, I love that. So they are, as therapists, I'm a speech therapist, Nat is an occupational therapist. Reflexes tell us a lot. They give us a lot of good information about the baby. And they tell us sometimes about why they may or may not be feeding well, why or why not they may be moving well. And so they're one piece of our assessment puzzle that help us kind of figure out what's going on. So can you talk a little bit about the reflexes that you're looking at, the reflexes you're looking for,
Sure.
and why it's so important? Why we're even talking about this today?
Yeah. I mean, reflexes tell me a lot about a baby's nervous system, which tells me about their ability to feed or not feed well, at least one part of it. And so I check reflexes on their feet. I check them on their back. I check kind of their whole body. I check the outside, the big stuff first. I only really check the feeding related reflexes later on. Although I do check their face, their rooting pretty early on too. But usually when I'm looking at reflexes, I'm looking for, are they there? Because they're ones that should be there. Are they there? Are they responding? How fast are they responding? Are they too fast? Because they can be over responsive and they can also be very under responsive. And oftentimes, they, like if we have a reflex on the bottom of our feet, we have 2 feet. So one foot is might be a lot slower than the other one. And so I'm going to look at that as an indicator for potentially a movement pattern that trickles all the way up the body. Like if that left foot is much slower to respond than the right, are we also seeing the same thing in their mouth? Because oftentimes we are. And so just checking their feet can tell me a lot. That's where I start. And so, but I'm also looking at big body-based reflexes as well as babies get a little bit older. And my job as an OT is not just to see if they're there, because that's what we're taught in grad school. You can test to see if they're actually there. What happens if they're not? Nobody tells you that. And so that's really where we as infant-based therapists, we have to not only check to see if they're there, but if they're not there, then we have to figure out why. Why are we not seeing that reflex? And what got in the way? And so that's really where I work in that area. Like my job is to work backwards and figure out what disrupted that and to get rid of that or to put the right pieces in place to see those reflexes emerge. Because reflexes, I wish everybody knew this, that reflexes are part of our blueprint, like you said, but it's like a developmental, we have to pass through them as part of our development in order to get to the next level. You can't skip them. If you skip them, you end up keeping them around, and most of them aren't supposed to stick around. And those cause a ton of issues with older kids, with grown-ups. We're not supposed to have most of our what we call primitive reflexes, but if for some reason we didn't use them as a baby, or we experienced a trauma as an adult or young adult or even kid, those reflexes can come back or they stick around and they get in the way. They're important as a baby, but they're not supposed to stick with us. But we have to address it in the infant phase first.
What would you say is the most common cause for not seeing a reflex? Is there something that you can pinpoint where
Definitely.
you're like, yeah, a lot of my babies, this is the major issue?
I would say tension, tension and or lack of strength, because those kind of go hand in hand. So those babies with really tight shoulders, we just talked about this in my mentorship program today. So we were talking about those tight shoulder babies. Most of our babies that don't feed well, they rely on their body to help. So they do this when they eat. They're stuck like this a lot of times during the day, which means their shoulders aren't getting this full nice range of motion. They're not moving freely. And so that one reflex, which is called, some people call it the fencer pose. I'll just call it that, but it's ATNR. When you turn your head, you're supposed to do this. Your arm shoots out to the side and your other hand bends. If your shoulder's tight, you might only see this part happening, but this other one stays down. That's a problem because you're not actually using that reflex functionally then to grab toys, then to develop shoulder strength. And that actually relates a lot to feeding abilities. And so I have to make sure that my babies move through that reflex appropriately to advance to the next level or stage in development, but also to make sure their shoulder muscles are strong enough.
Yeah.
So, and so that can be tension, and it can also be strength. If that baby's shoulders are just kind of weak, then sometimes we have to help it out. So.
And where do you see in your practice what's causing that tension?
Ooh, I mean, tension is often present at birth because babies are stuck in some sort of squished ball-ish in utero for a long time, and that tension should melt away. But when babies are compensating for a lack of feeding skill or feeding dysfunction or any kind of oral motor dysfunction, they oftentimes rely on that tension pattern to be able to eat well as they can. And it doesn't drop away. Gravity doesn't work its magic, and our reflexes don't emerge. And so that's usually one of the reasons that tension sticks around, because we use it for stability. This makes things stable and tight. It doesn't allow for a lot of movement, but it allows a baby to feed somewhat effectively. It might just be
Yeah,
uncomfortable.
I was going to say I often see tension from how the baby was positioned in
Yeah,
utero. Mom might describe it, oh my gosh, their shoulder was like
right up
stuck for
there.
weeks. I always felt them up in a certain, I felt them in my ribs. You can see it in breech positioning where they're upside
Oh, right.
down, not
Yeah,
developed the correct way. And a lot of times it can be from birth,
yeah.
from sitting really long in the birth canal, from forceps or
Being
vacuum
pulled out.
birth, from
Right. Yeah,
sometimes
absolutely.
from C-sections, from how they were pulled out. You can see that. And then a lot of times, if parents aren't vigilantly catching it, they're like, oh, yeah, the baby always turns this way.
Yes.
And when I try to go the other way, the baby fights me. So then they're constantly in this pattern. So they're constantly reinforcing that tension.
Yeah. And so I was going to say the other issue with tension is a lack of movement once the baby's born, and tension can be something that comes about postnatally as well, because when we don't develop adequate strength to move through developmental stages, when we're always swaddled or we're always in a carrier, or all our movement is restricted more often than it should be,
Yep.
when we try to go do things like sit up, or we're doing tummy time and we're trying to do tummy time, but it's really difficult because we don't have shoulder strength, we're going to just arch our back. And then a lot of babies that we see get stuck in that tension pattern, that retraction. And then that causes a lack of face reflex integration, all of that stuff, because everything's pulled backwards. And that all comes from not moving enough as a baby. So there's a lot of different reasons why.
And what I'll often tell parents, because I tend to catch babies, I see babies 3, 4 days, and first evaluations 2, 3, 4 weeks. I'm kind of in those early stages. A lot of what I'm teaching parents is intentional handling of
Right.
let the baby stretch and roll out, get them into a guppy pose, get them in moving their head side to side, moving around, hold them in different ways other than just this like I need to keep the baby's head perfectly still, don't let the baby's head move, right? And like to tight and contain, like no, get them out, let them stretch, let them move, to really help with that process of stretching it out. And when I see like, oh, there's a tension pattern of like, oh, that's more than what we can just do with moving the baby around, I'm sending them to therapists like you to work intentionally on getting that out.
Yeah. I mean, that's same thing. I get them usually a little bit older than you're getting them, but not always. And yeah, I think we talked about this last time we spoke, and it's a recurring theme, like allowing for that freedom of movement and that opportunity for babies to find what feels comfortable for them. We especially culturally, we treat babies as little fragile things, and they are fragile when they first come out, but reflexes are really powerful. I mean, look at the breast crawl. The breast crawl is the most perfect example. When I lecture about this, I always talk about this. Like that's the second reflex you're going to see. You're going to see the moro, which is that startle reflex, which is, it literally allows the baby to take their first breath.
Yeah.
That is how they don't know how to breathe on their own. They reflexively go, and then they breathe it. And then hopefully we put that baby on the breast, or we're able to, and they start to do a breast crawl. And there's a whole series of reflexes that are being fired there, to allow that baby to crawl up to that mom's nipple and find a source of food. And they're not choosing to do that. It is 100% reflex based. But if we're immediately putting that baby into a blanket or swaddling them or whatever, we're restricting that movement ability and taking that away from them. We have to learn what it feels like to move in space in all the ways.
It's really interesting because I teach a lot of prenatal breastfeeding classes, and we watch the global health media video on attaching right after birth.
Mm-hmm.
And all of those babies, I think there's 3 or 4 that are shown, they're placed on the abdomen and they all crawl and latch. And I find it really interesting that that video was designed in other countries where unmedicated vaginal deliveries with minimal interventions are happening, where that's allowed to happen.
Yeah.
So baby comes out, has their first cry, put immediately on the body, and then left alone without intervention until after that first latch. Usually involves delayed cord clamping, usually involves significantly delayed bathing. They're not even usually weighed or measured or footprinted until like later in the day or maybe even the next day. And a lot of that has been missed in Western hospital births where a baby comes out. They take some hospitals still will take the baby immediately away, wash the
Feed the
baby
baby.
off,
Yep.
weigh them, footprint them, do all of the medical interventions, and then bring baby back, sometimes
Yeah,
swaddled.
with the hat
And
on
sometimes,
too.
yes, in
Yep.
postpartum, that first latch is happening, but it's often like we're going to swaddle and then latch for you instead of letting the baby do those things.
Absolutely. And yeah, we're designed to do so many things. And I think one of the things I love when I'm teaching parents about their own baby's reflexes is to actually show them what their baby is capable of. I mean, even a 2-week-old baby has these amazingly powerful reflexes that allow them to find a food source, like you said, or to turn and find the source of comfort, to a smell, to a familiar smell. But also, they'll turn their heads if they're face planted on the surface, and they'll actually clear their own airway. It's pretty cool. We're designed to survive, and that's what those
Well,
reflexes do.
and I think it's also important for people just to even be aware of these reflexes, because a lot of times they will get in the way of breastfeeding without even knowing it, right? Like the ATNR you were talking about, the fencer.
Mm-hmm.
If you have a baby that you're putting at the breast on their back and you're
And they're
turning their head to
having
come
to
to
turn
the
to feed.
breast to
Yeah,
latch, you can often, then parents are like, the baby is fighting me. And you're like, no, they're not fighting you. You're triggering
right,
reflexes where that baby is, they're doing what they should do. They're turning into ATNR at the breast. And as soon as we roll that baby in, stop triggering that
right,
reflex, they then will kick into babkin or rooting or
right.
sucking, because we're then not triggering the other reflex.
Super true. I never thought about it like that, though, to be honest. But yes, I agree. I guess I don't see. I do see overactive reflexes, but never that one. Honestly, I have to work so hard to elicit in so many of my babies that I don't usually see that one getting in the way.
I
But
see it a
yes,
lot in the newborn, very, very
that
early
makes
newborn,
sense.
because they really are. They have them flat on the back
And they're
and they're
turned to feed.
turning the head,
Yeah,
and it really is, they're like on the back on the pillow, and so they're, and they already have one arm flexed anyway because they're so tight, so
right.
then it's like they're literally just doing
Flexing
that.
up there. Yep.
Yeah, it's at the breast. It's quite wild.
Yeah, it's
So,
pretty cool. And these reflexes are amazing because they actually, most of them serve purposes in utero as well. We suck in utero. That ATNR reflex is not just to help us learn to grab toys. Yes, and it does help us build depth perception and that kind of thing, hand eye coordination or eye hand coordination. Um, After about 3 months old, but in utero, it also helps us move through the birth canal. And so we haven't talked about this yet, but like so many of these our spinal galant reflex help with that too. And so those help us wiggle our hips and actually shimmy through the birth canal in this cross diagonal pattern. And if babies are stuck or there's something disrupting their birthing process, or they're delivered via C-section, we don't get an opportunity to use those reflexes.
yeah.
And that can be problematic too, because oftentimes we have to work a little bit harder to turn on those reflexes once that baby's born. There's a flip side to that though, because oftentimes when parents come in and I take their history and they talk about their birth history and that they had difficulty, their delivery was difficult, etc., they usually talk about it from the perspective like there was something wrong or something happened with the mom. The mom was the problem. But usually I ask about, okay, well, how long, what was your baby like? Were they active? Were they stuck? If I get more information about that lack of movement, which oftentimes is the case in utero, that tells me a lot about that baby's nervous system before they were born. And then once they're here and I'm evaluating them, oftentimes we're seeing similar things. It's not like in utero is, happens
Right.
irrespective of what happens outside. And so oftentimes the baby's nervous system or lack of reflex firing disrupts the birth process. It's not always the other way around, is what I'm trying to say. Yeah.
Yeah. Yeah. That's
And I don't
that's
think that especially, I mean, I don't think providers are looking at that or even considering that it's the baby's part in the
right.
birthing process that is, not that
Yeah.
there's much we can do about it in utero, but it's still interesting to note.
Well, and sometimes that has to do with birth interventions, right? Was there an
Absolutely.
epidural placed where mom wasn't allowed to move? So now she's in a static position, where baby's in a static position, versus mother being able to move around, where then baby
And
can
getting on all
still
fours or whatever,
really.
right.
move. Yeah, so her being able to go fours on her back, standing, squatting, using movement herself to then allow the baby to have additional movement as well,
Yeah,
really play a difference. Also, just the size of that person, right?
all
If
of it.
I'm 6'1", I had lots of space for my babies to move, but I have a lot of patients that I work where they're like 4'11" to 5'3", and had large, normal sized babies, 7, 8 pound babies, but their torsos are so much shorter. So it's just and if they didn't grow out, they stayed fairly narrow. Like that's a
Right.
different space for movement.
Absolutely. And that's just all, it's all important to take into account. But the nice part is that, yes, I do take a history and I like all the details, but once I'm working with them in my office or wherever virtually, like it's all the same. We still have to see them. We still have to go through the same motions. Pretty much all human bodies are built very similarly when it comes to these patterns. And so we've still got to go back to ground zero and really make sure that all of these things are in place and we hit them all when we were designed to. And if we didn't, we have to go back and put them in place so that we can continue to develop strong, healthy brains and bodies.
Yeah.
Yeah,
And what now for people now, you and I as therapists kind of understand that and
sure.
things that I'm doing in the practical real world. What are you doing to help those babies then hit those
Good
reflexes?
question. First of all, we're moving them. I mean, we're
Yeah.
teaching them how to move through a full range of motion. So like we were talking, and I know you had I think a reel the other day about the rooting reflex. I'm getting babies to spend more time on their sides.
Yeah.
So we're looking at babies, they're four-sided. Like we have a left and a right and a front and a back. I'm teaching parents that we can't just put babies on their bellies and their backs. We have to put them on their sides too. And a lot of babies, especially as they get a bit older, if they are sometimes they avoid putting their cheek down on the surface for lots of different reasons. And when I'm working with my older babies or my toddlers, we have to go back to that and we have to teach them. I literally show parents how to roll their babies on their beds and squish their cheeks into their comforters to turn on that root, because they should have done that on their own, or they should have worked on integrating that when they were during infancy and they didn't. So it's a lot of movement, but it's a lot of exposure and it's a lot of gravity. Like I'm letting gravity work its magic, but we're also building strength too. And so like the startle reflex, that's a big one that most parents are familiar with, just as it relates to sleep, especially since we have an interesting sleep culture as well. Um, Back to sleep is certainly not helping our generation of children integrate their reflexes well, because we're having to restrict movements with swaddles much longer than nature intended. And sleeping on our backs does not help us fire reflexes. We have reflexes that fire when we're on our bellies because we're pushing up, we have something to resist, but we don't really have many on our back. And so where was I going with that? But things I'm doing, the head control. So Moro reflex, that startle response, I would say I have to work on head control, which neck strength, shoulder strength,
Yeah.
being able to keep that head upright and see an elongated neck, or just finding babies' necks with 80% of the babies at least that I work with, if not more. Yeah, I mean, if your baby is, 8, 10 weeks old and your head is, we still can't see their neck at all when they're upright and they're wobbling when they're in your arms or they're on your lap, that's something we can work on. We work on by strengthening it. We work in anti-gravity positions where they're maybe we lower them slowly to the surface and maybe we pull them back up. It depends on how old they are, but we let them work against gravity to build muscle strength so that then our body's not registering every head bobble as a startle. That's a really, really important one. And so strengthening is a big, big part of what I'm doing with babies. And it's interesting because a lot of the babies that we work with, they come in very tight, very tense, and parents think they're very strong.
Yeah. My baby rolled at 2 weeks.
Right.
No, they didn't.
And so that's a big part of these reflexes, though, is that those tense babies that seem very strong and they're always up like a sphinx during tummy time, they're actually not that strong. They're tense. And those are the ones that don't integrate their reflexes and retain them much longer than they should. And so our job is to essentially take that apart, put actual strength in place so that we can move our body parts separately. And that tension isn't, the only thing that we're relying on, and then move on from there.
100%.
Yeah.
Now, in all of that, do you have a favorite reflex?
I really like working with the ATNR one because it's magic. No, they're all magic, which is really cool. But I think it affects so much from a learning perspective too. All of my older kids that I see, any of you guys out there with toddlers or older elementary school kids, I mean, this one affects dyslexia. It affects reading. It affects math. It affects memory and cognition. I mean, and all of these can, especially because they kind of clump together in clusters, can affect all of that. But if we can't cross the midline of our body comfortably, and if we don't understand fully and perceive that our right side and our left side are two separate things, our brain doesn't cross over messages really effectively from one side to the other as we continue to grow, and we'll continue to take shortcuts. So I take a lot of pride in making sure that that is intact in my babies, obviously for feeding abilities early on, but I know how important that is from just a general developmental trajectory. And it's really easy to see, first of all. So it's like kind of magic when you see it really fire like this. It is kind of textbook when it works well. And I can show parents and they get excited about it, but it really does make such a big difference. They all do, but that one's really fun to work with. And that's when babies start to grab toys and become little humans.
Love
So
that.
it's fun.
My favorite is Babkin.
Wow.
Not a well-known one. I just posted on this maybe a week or two ago, and people were like, "You mean Babinski? That's in the feet." And I'm like, "No, Babkin, it's in the hands."
Yeah.
When you touch the palm, there's a couple reflexes.
Yeah.
You've got the palmar grasp where hand
Yeah.
comes down and grabs, but Babkin is when there's pressure put in the palms, babies will actually open their mouth.
Yeah.
And if you do it one-sided, they'll open and turn towards that hand. And it's needed for latch at the breast. So when their palms are on the breast, mittens are off, they'll actually go, and they'll open to find that breast. And I think it's a really underrated reflex.
I totally agree.
Because most people don't even know about it. They don't know it exists. They're like, I didn't know that was a thing.
I love showing parents that one too. I have a reel about it as well, but I work with so many toddlers that still have all of these reflexes and have feeding issues. And I know we're running out of time, but I like to take a piece of tape. I had one the other day and this was so cute, but also very illustrative. We took some blue tape and I put one on the palm of her hand here and the palm of her hand here. And this is how she was stuck for 5 minutes.
Yeah.
She walked around her living room, but she was stuck.
Yeah.
Because we fired that reflex and she was really good at avoiding touching things on the palm of her hands. But this one was like, oh my gosh. And her nervous system was going, wow, what's happening? And we saw it. It was very cool. So
it's wild to see them later on. I guess he was almost 7 months, and I went to do something here, and he was still rooting.
All of my
but it was like
still root.
Really strong. But it was like like baby shark root. And I'm like, oh, and so it was talking through with the mom about the triggering the reflexes and them integrating and doing activities like what you're saying to try to help those reflexes integrate in the appropriate time, because it is wild when it's always cool to see them at the appropriate time, but then it sometimes is wild to see them being elicited at other times. And we can even see these, as you were saying earlier, in adults.
Oh, absolutely.
Startle reflex is the fun one. You'll see lots of TikToks of people trying to startle theirs, and they'll do this.
And I mean, that fencer pose is also, if you get them in all fours and you have them turn their head to one side, you'll see their elbow bend on the other side. I would venture to say a lot of grown-ups still have that reflex too. And grown-ups can also work on integrating reflexes, and it helps with a ton of anxiety. It helps with just a lot of cognitive processes. So there are programs out there too that do this, not just OTs, but there are actually some on the market now that do this, and it's pretty powerful stuff. And it really does work on your brainstem. It's very cool. So
it's really cool. Well, thank you so much again for coming on. This is obviously
always a pleasure.
One of my favorite topics. I'll be teaching on this topic in May at a lactation conference about how to assess babies, because I do think a lot of times we're not using reflexes to our advantage.
Agreed.
And or then appropriately referring out. And I do think it's a big thing that every lactation provider and every early intervention therapist should be aware of, how to look for them, what's appropriate, what's not appropriate, timing of them, and all that good stuff.
Agreed.
So thank you again for bringing new light to this topic.
Always a pleasure. Thanks, Julie.
All right. See you next time.
Okay. Bye.